Have you started regaining weight after sleeve gastrectomy? Maybe it's 5 pounds, maybe it's 10. Maybe the scale is creeping up and you're thinking, did my sleeve fail? Did I stretch it? Am I going to gain it all back? Pause for a second. First, you're not alone. Second, some degree of regain over time can be normal. And third, the earlier you respond, the easier it is to stop. In this video, I'm going to explain in a clear and practical way what normal regain looks like after a sleeve, what patterns are warning signs, why regain happens, even when you feel like you're doing everything right, and the step-by-step plan to get back on track. Let's set expectations, because expectations reduce panic. Most people reach their lowest weight, their nadir, around year 1 to year 2 after sleeve gastrectomy. After that, it's common to see a period of stability, and then, often around years 3 to 5, some people regain a portion of the weight they lost. That does not automatically mean the surgery failed. The sleeve is still doing its job. But your body is adapting, and your habits may drift without you noticing. Here's the key. We need to separate fluctuation from trend. Fluctuation is normal, a few pounds up and down due to hydration, salty foods, hormones, constipation, stress, poor sleep, changes in exercise. A trend is different. Weight increases month after month. Portions are clearly bigger than before. Grazing and snacking return, liquid calories creep in, protein drops. You stop follow-up, you feel less satiety and more hunger. So I want you to ask yourself a simple question. Am I fluctuating or trending upward? And if you're trending upward, the next question is, why is it happening? Because weight regain after sleeve usually has more than one cause. In support group conversations, people assume there must be one single reason, like my sleeve stretched. Sometimes sleeve capacity plays a role, but most of the time the story is a combination. Biology pushing back, small daily choices adding up, and less accountability over time. Here's a helpful mindset shift. Regain is not a moral failure, it's feedback. Feedback means you can adjust, and adjusting early is powerful. Before we go into the causes, I want to give you a reality anchor. Even excellent bariatric procedures tend to lose some effect over long time frames. Your body has deep survival mechanisms designed to defend its highest weight. That doesn't mean you're doomed. It means you need a maintenance strategy, not just a surgery. When people say, my sleeve failed, they might mean, I didn't lose as much as I expected. I regained some weight. I'm having reflux or vomiting, or I feel hungry again and can eat more. Those are different problems, and they have different solutions. Today we're focusing mainly on weight regain. Quick mini case to make this real. A patient once told me, I regained 12 pounds. I must be the one person the sleeve doesn't work for. When we reviewed the timeline, the regain started after a job change. Lunch became inconsistent. Protein dropped. Coffee drinks increased. Follow-up visits stopped. Nothing was crazy. It was just drift. We rebuilt structure for 2 weeks, protein first, planned meals, and a simple walking routine. The trend stopped. So here's your first pause and check moment. Right now, if you had to name the earliest sign that things started slipping, what would it be? Stress, sleep, travel, snacking, alcohol, stopping the gym, stopping appointments? Just name it. Don't judge it. Name it. All right, framework time. Next, we'll talk about the 3 pillars.
Let's talk about the uncomfortable truth. Your body is designed to resist long-term weight loss. Deep in the brain, the hypothalamus regulates survival functions, breathing, heart rate, temperature, and it also helps regulate body weight through powerful hormonal signals. After you've reached a higher body weight for a long time, your body treats that as the new normal. It will subtly push you back toward it. That pushback can look like hunger returning, cravings increasing, energy dropping, the body becoming more efficient with calories and a slower metabolic rate than you'd expect. This doesn't mean you did anything wrong. It means you need a system for maintenance. Now here's the model I want you to remember. Think of sleeve success like a 3-legged stool. Leg nerf 1, the surgery. This includes the sleeve shape and size, the technical quality of the operation, and how your sleeve behaves over time, specifically its capacity and emptying rate. Leg number 2, your behaviors, the U factors, food choices, grazing, liquid calories, and alcohol. This covers protein intake, speed of eating, stress eating, sleep, movement, and daily structure. Leg number 3, follow-up and support, regular check-ins, accountability, labs, and nutrition guidance. This leg includes behavior coaching and early problem solving. This keeps the whole system stable. If all 3 legs are strong, the stool holds. If one leg weakens, you wobble. If 2 legs weaken, regain becomes more likely. If all 3 weaken, regain accelerates. Most assume regain is only the surgery leg, like the sleeve stretched, but it's usually drift plus loss of follow-up. Let's break down the drift patterns. Grazing is the #1 enemy. It bypasses restriction. You never get a true satiety signal. A few bites while cooking or driving, the calories add up quietly. Next, liquid calories. They slide through the sleeve. They don't create the same fullness as solid food. Specialty coffees, smoothies, and alcohol are classic regain accelerators. They bypass the stop signal. Small treats often become daily treats. People think I can loosen up a little after the weight loss phase. Maintenance has a narrow margin. An extra 200 to 400 calories daily can shift you into regain. Protein drops, muscle drops. Protein protects muscle, muscle protects your metabolism. Without strength training and protein, your metabolic engine becomes smaller and less efficient. Eating too fast is another trap. The sleeve empties faster than a normal stomach. Slow down for satiety. Eat slow, and hormones trigger satiety. Eat fast, and the sleeve fills before the stop signal arrives. Pause and reflect. Which of these patterns sounds most like your real life right now? Grazing, drinks, protein? A patient told me they were hardly eating, but tracking revealed 700 extra calories in small snacks. Nothing felt huge, but the math was huge. That is why tracking isn't punishment, it's clarity. One more concept, the calorie threshold. Over time, as capacity returns, you move closer to a maintenance zone. You may be stable at 1,000 to 2,300 calories, but if you rise above your threshold, regain begins. But not all calories behave the same. High refined carbohydrates trigger blood sugar spikes and hunger. That hungry again feeling leads to snacking, which repeats the cycle and pushes you over your threshold. Protein behaves differently. The body uses more energy to process it, and it significantly increases satiety. A protein-focused plate impacts hunger very differently than a high-carb plate, even with similar calories. In Block 3, we'll dive into the capacity question, when anatomy matters, reflux, and hunger signals. Stay tuned as we uncover the common traps that push people into regain. See you in the next block. Welcome back. Today we address the question every patient asks, has my stomach stretched? Let's dive into the capacity question. It is a common fear that regain is caused by the sleeve stretching, but anatomy is only one part of the story. Over the first 2 years, your sleeve naturally matures. There's a difference between a functional increase in capacity and actual anatomical stretching. Functional capacity means your body is adapting. You can eat a bit more than those first few months, which is normal. One of the biggest traps is acid reflux, or GERD. It doesn't just cause heartburn, it can mimic hunger. That burning sensation in the upper stomach is often mistaken for a need to eat. Patients eat to push down the acid, creating a cycle. Then there are the hormones. Ghrelin, the hunger hormone, can slowly return as the body tries to reach its old set point. Satiety signals like GLP-1 are triggered by food hitting the small bowel. If you eat the wrong foods, these signals are weak. This brings us to slider foods. These are highly processed carbs that dissolve quickly and slide through the sleeve without triggering fullness. You can eat large volumes of slider foods because they don't provide the mechanical stretch needed for satiety. We must also distinguish physical hunger from head hunger, eating triggered by stress, boredom, or habit. Head hunger often hits suddenly and specifically for comfort foods. Physical hunger builds slowly and is satisfied by protein. Many patients think they are eating too much in volume, but the real issue is often the calorie density of what they choose. Remember the 20-minute rule? It takes that long for your gut to tell your brain it's full. If you finish in 5 minutes, you'll overeat. Chew every bite to a sauce-like consistency. This slows the process and allows satiety hormones to work. Watch for the early signs of regain, increased grazing, gravitating towards slider foods, and neglecting your protein goals. The solution is returning to the system, strengthening your behaviors, and reconnecting with your support team. Your anatomy is a tool, not a cure. Understanding how capacity, reflux, and hormones interact is key to maintenance. In our next block, we'll discuss the long-term metabolic game and how to monitor your data for a lifetime of success. Welcome to Part 3. We've covered biological resistance and hunger traps. Now we focus on the long game, how to monitor your progress for life. The biggest mistake patients make is only looking at the scale. The scale tells you your weight, but it doesn't tell you your health or your metabolic future. Body composition is what matters. Muscle is your metabolic engine. Losing weight while losing muscle actually slows your metabolism down over time. To keep your metabolic rate high, you must focus on muscle preservation through resistance training and high protein intake. Then there's the data you can't see. Regular labs are non-negotiable. We track micronutrients and metabolic markers to catch drift before it becomes regain. Labs are your early warning system. If your protein levels drop or certain markers shift, it tells us your behavior leg is weakening before the scale even moves. Maintenance isn't a straight line, it's a trend. Monitoring these trends over months and years gives you the clarity to stay in your threshold zone. Your 3F framework must evolve. Food, fitness, and follow-up look different at year 1 than they do at year 5. Food becomes about intentional structure, moving from restriction to selection, choosing the foods that support your goals every single day. Fitness shifts from burning calories to building health. Resistance training is the key to protecting your metabolic engine for the long term. Follow-up is about accountability. Never go it alone. Whether it's your medical team or a coaching group, staying connected prevents behavior drift. Maintenance isn't a destination, it's a lifestyle. It's about the freedom that comes from being in control of your metabolic health. Your surgery gave you a head start. Your behaviors and your system will give you the finish line. You have the tools. Now keep using them. Thank you for joining this masterclass. For more resources and coaching, visit Bariatric Surgery 360. Your journey continues. Now let's address the question everyone asks. Did my sleeve stretch? Capacity after sleeve can increase over time. That is expected. Most sleeves will tolerate more volume at year 1 than at month 3. Many patients describe it like this: some days I can eat more than other days. That variability is normal because fullness depends on stress, sleep, speed of eating, hydration, and what you ate earlier. But in some cases, anatomy does contribute to regain, especially if the sleeve started larger or if the sleeve has expanded in a way that allows bigger portions without discomfort. Here's the practical way to think about it. If you can consistently eat large portions and you feel hungry soon after meals, anatomy might be part of the story. If your portions are not that large, but you're grazing, drinking calories, or eating refined carbs frequently, behavior is likely the main driver. And in real life, it's often both. One analogy that helps: imagine a long, thin balloon. At first, it's hard to inflate, but as it expands, it becomes easier and easier to inflate because the wall tension changes. A sleeve can behave similarly. If you start smaller, it tends to resist expansion more. If you start larger, it may expand more easily. Now, how do clinicians evaluate the anatomy side? Usually, it's not guesswork. A good assessment includes a detailed nutrition and behavior review, portion analysis, sometimes imaging like a contrast study, and sometimes an endoscopy if symptoms suggest it. But here's the critical point. Even when anatomy is part of the problem, you still need behavior correction first. Because revision procedures are more complex than primary surgery, and repeating the same habits after revision leads to the same outcome. So if you're worried about failure, think like a team. We first fix the controllable daily factors, then we evaluate whether the anatomy is limiting progress. Let's talk about the common saboteurs that push people across the regain threshold. Alcohol. Alcohol is calorie dense, it lowers inhibition, and it often comes with snacking. Even a few drinks on weekends can shift the weekly balance into regain territory. Sweets and refined carbs. After sleeve, refined carbs can create a cycle. Quick absorption, blood sugar spike, then a drop, then hunger returns sooner, then more snacking. People describe it as, I wake up hungry, I eat something sweet, then I'm hungry again. How do you interrupt that cycle? Not with more sugar, you interrupt it with protein, fiber, and low glycemic choices. Specialty coffees and milky drinks. Creamy coffees can feel small but carry hundreds of calories. Some patients also use milk to soothe reflux and then repeat it throughout the day, creating a liquid calorie loop. Which brings us to reflux. Reflux and misreading signals. Reflux can feel like hunger. Some patients eat or drink milk to buffer the acid, feel temporary relief. Then symptoms return. Then they repeat. This can lead to regain. If reflux is significant, treat reflux direct through medical evaluation and appropriate therapy rather than feeding it. Now let's talk about hunger hormones. Hunger returning is not a personal failure. After sleeve, the hunger hormone ghrelin often drops early. Over time, appetite can return somewhat. That's expected. The goal is not to rely on never feeling hungry. The goal is to use structure so hunger doesn't control your day. Two mini cases. Mini case 1, a patient regained 15 pounds and blamed capacity. But the real shift was 2 daily coffee drinks plus evening tastes while cooking. When we removed liquid calories for 14 days and reintroduced planned protein snacks, the trend stopped. Mini case 2. A patient had reflux and kept sipping milk all day. Weight slowly rose. Treating reflux properly and rebuilding meal structure made the mystery regain disappear. So ask yourself, do I have reflux symptoms that I'm treating with food? Do I rely on liquids for comfort? Do I snack when I'm stressed, tired, or bored? One last high impact factor: eating speed and washing food through. If you eat quickly, you can outpace your satiety signals. Try this. Set a timer for 20 minutes for a main meal. Take smaller bites, chew thoroughly, and pause between bites. Give your gut time to send the full message. Also, watch the habit of drinking with meals. When people wash bites down with liquids, it can reduce fullness and make it easier to eat more. Pause and check. When you eat, are you present or distracted? Do you stop at the first sign of fullness, or do you finish the plate out of habit? In Block 4, we'll build your action plan, the exact reset steps, when to return for evaluation, and how to rebuild food, fitness, and follow-up without perfection. If you're regaining weight after sleeve gastrectomy, your goal is not to panic diet. That is the first mistake. Your goal is to rebuild the 3-legged stool. The surgery leg, evaluate if needed; the behavior leg, structure; and the follow-up leg, accountability. Here is the practical reset plan. Do this for 14 days with real commitment, because short, focused resets work better than vague "I'll try." Step 1, reconnect with follow-up. Schedule a check-in with your bariatric team, even if it's virtual, not because you're in trouble, but because accountability works. Early regain is easier to correct than late regain. Take the step now. Step 2, stop grazing, return to meals. For 14 days, do structured eating. 3 meals per day, or 3 meals plus 1 planned protein snack if your team recommends. No continuous nibbling, and definitely no taste while you are cooking. No eating in the car, and no eating while scrolling. If you need a snack, plan it. Don't improvise it. Step 3, protein first, every time. Make protein the anchor of every meal. Then add vegetables. Then add small intentional carbs if appropriate. Protein is the priority. Most regain patterns improve quickly when protein is prioritized at every single sitting. A quick question before you eat: where's the protein in this choice? Ask yourself every time. Step 4, remove liquid calories completely. For the reset period, remove all specialty coffees, remove sugary drinks, smoothies, juice, and alcohol. This step alone can stop regain for many people. Step 5, track for clarity, not forever. Track intake for 7-14 days. Not to punish yourself, just to reveal patterns. Most people underestimate invisible calories. Think of the drinks, bites, bars, sweets, and weekend extras. Data replaces anxiety with clarity. Step 6, strength plus daily movement. You don't need a perfect gym routine, you need consistency. Aim for resistance training 2-3 times per week, bands or body weight count. It makes a difference. Plus daily walking or movement. The goal is muscle preservation. Muscle protects metabolism. Step 7, fix the root trigger. Pause and reflect. What changed right before the regain started? Was it stress, poor sleep, travel, a life event, medication, depression, or perhaps reflux? Pick one trigger to address directly. One repaired trigger often improves the whole system. Now, when should you consider an anatomy evaluation? This is an important consideration. Consider further evaluation if you can eat large portions with very weak satiety after meals, or if you feel hungry soon after solid meals, or if regain continues despite a structured reset. Consider it if reflux is severe or if you have a history of prior banding before the sleeve. The key is sequence. Reset and follow up first, then evaluate anatomy if needed. Quick mini case to close. A patient once said, "I didn't come back because I felt like I failed." They waited 2 years, regain continued, stress increased, habits got looser, they felt lost. When they finally returned, the solution was not Shema, it was a structured plan. And support, we rebuilt meals, removed liquid calories, reintroduced strength training, and treated reflux properly. The trend slowed quickly. The patient didn't become perfect, they became supported again. Also remember, the smaller details matter most in the maintenance zone when calories are tight. So pay attention to the small stuff, especially drinks, sweets, and unplanned snacks. It adds up. Save this plan, replay it when you drift, and remember, early correction is the secret weapon. Tell me in the comments how far out you are post-op. I want to hear your story. Subscribe for more clear bariatric guidance because you deserve long-term success. See you next time.